The top stories tonight in Y News. The National Task Force is planning to strictly implement the no home quarantine policy on asymptomatic and mild COVID-19 cases. NTF Chief Implementer Secretary Carlito Galvez Jr. has recognized Valenzuela City and the province of Bulacan for implementing the no home quarantine policy, citing that aggressive isolation is effective to lower the number of infection within.
I strongly agree sa sinasabi ng ni Valenzuela Mayor na mahirap yung magkaroon ng home quarantine kasi kaya yung Valenzuela at saka Bulacan ay nagpapa-implement sila ng no home quarantine policy.
The health department warns hospitals it is against the law to detain patients with unpaid dues. The DOH clarifies, however, it is just for a hospital to be given assurance that a patient would be able to settle unpaid bills.
Bawal po tayo mag-detain ng ating mga pasyente because they cannot pay as of this time. Alam niyo naman po, ang mga ospital ay mga entities din po ito na gumagastos, no? So they need din po na mabayaran din naman sila.
The Office of Civil Defense will make sure to implement the minimum health standards during the simultaneous national earthquake drill on September 10, 2020. The NDRRMC, meanwhile, orders local governments and the private sector to update their disaster contingency plans.
President Rodrigo Duterte has advised Health Secretary Francisco Duque III not to resign, while Senator Panfilo Lacson says the health chief has been cleared of any wrongdoing in the PhilHealth mess. For Senate President Soto, on the other hand, President Duterte should talk to senators, not just listen to excuses.
Thailand records its first local COVID-19 transmission after 100 days, but half of almost 1,000 people who had been in contact with the patient test negative for the virus.
Dozens of Australian companies fined for misleading advertising and illegal importation of health products claiming to prevent COVID-19.
Good evening, Philippines and the world. Today is Tuesday, September 8, 2020. I am Horilyn Delgado. Join us in the next hour as we deliver today's top stories around the country and in other parts of the world.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Theo.
First in the news, the National Task Force is planning to strictly implement the no home quarantine policy on asymptomatic and mild COVID-19 cases. Joan Nano tells us why.
The National Task Force Against COVID-19 aims to prevent further transmission of coronavirus among members of a family. Based on the government's existing guidelines, home quarantine is allowed for COVID-19 patients who are asymptomatic and mild cases, provided they have a separate room and comfort room. NTF Chief Implementer Secretary Carlito Galvez Jr. has recognized Valenzuela City and the province of Bulacan for implementing the no home quarantine policy, citing that aggressive isolation is effective to lower the number of infection within a household.
Mahirap yung magkaroon ng home quarantine kasi kaya yung Valenzuela at saka Bulacan ay nagpapa-implement sila ng no home quarantine policy. So talagang kailangan po yung isolation phase natin is very aggressive at saka absolute. Na lahat po ng positive, kailangan po talaga natin i-isolate. Kasi nakita po natin, even yung mayayaman po na nag-home quarantine, nagkakahawahan po yung kanilang mga kamag-anak.
Secretary Galvez adds there has been a significant decrease in the number of infections within Central Luzon, Calabarzon, and Metro Manila, particularly in Navotas City and Pateros. He attributes this development to the transfer of COVID-19 patients to isolation facilities.
Nung tinanggal po natin yung home quarantine sa area na yun, talaga nakita natin bumaba ang napakalaki ang mga kaso po dun sa area po na yun. At nakikita po natin na talagang kung magkakaroon po tayo ng aggressive isolation, ng mga positive cases at maihiwalay po natin yan sa community, malaki po ang tsansa na talagang bababa ng hindi lang po magpa-plateau, but magbababa po, hindi lang magpa-flatten ng curve, kundi bababa po ang ating cases into a single-digit number.
In an interview, DILG Secretary Eduardo Años said that he has discussed the matter with the National Task Force and the no-home quarantine policy could be implemented within this week. He also mentioned that there will be some exemptions to the rule. For an instance, an elderly who will find it hard to transfer to an isolation facility but can at least take care of himself while in home quarantine. Secretary Año added the Department of Health and the City Regional Surveillance Unit will evaluate if a certain patient must be exempted from the policy. Joan Naro, UNTV News and Rescue. We serve the people, we give glory to God.
The health department warns hospitals that it is against the law to detain patients with unpaid dues. Our health correspondent, Aiko Miguel, tells us why.
Republic Act 9439 or the Anti-Hospital Detention Act states that it is prohibited to detain a patient who has been permitted by a physician to be discharged from the hospital despite unpaid dues. This is what the DOH explained after receiving information that a private hospital is detaining a patient for unsettled hospital bills. The DOH clarifies, however, it is just for a hospital to be given assurance that a patient would be able to settle their unpaid bills.
Bawal po tayo mag-detain ng ating mga pasyente because they cannot pay as of this time. Alam niyo naman po, ang mga ospital ay mga entities din po ito na gumagastos, no? So they need din po na mabayaran din naman sila. Although hindi talaga tama na nadidetain ng pasyente, pero kailangan ang mga pasyente rin po at ang pamilya ay makapag-iwan ng para pong katunayan, no, na babalik sila.
Because it is prohibited to detain a patient, he could just leave an ID or a document as a proof of his identity. This is to assure that the patient will not neglect his obligation to the hospital, although he could already be discharged. The DOH also emphasized that hospitals should not refer patients or family members to a lending facility to apply for a loan in order to pay hospital bills. A patient has an option to submit a letter to arrange the payment on installment basis.
They can leave a promissory note with that promise, of course, that they have to pay in installment kung kailangan. It is not also a good practice that hospitals will be directing patients to lending facilities and all.
The DOH also tells the public to also understand the situation of hospitals when dues are left unpaid. The law also states that any officer or employee of a hospital or medical clinic proven to commit violations will be fined with 20,000 pesos to 50,000 pesos or imprisonment of 1 to 6 months or both at the discretion of the proper court. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
As cases of coronavirus infection continue to rise in Catbalogan City in the province of Samar, 22 of its barangays have been placed under Enhanced Community Quarantine or ECQ until September 20. The ECQ limits the movement of people in Barangay 1 to Barangay 13, Canlapuas, Bunuanan, Gindapunan, Ginsorongan, Maulong, Muñoz, San Andres, and San Pablo to stem the spread of the virus. The 24/7 curfew and the liquor ban are strictly enforced. All social and religious gatherings and even outdoor exercises are prohibited. The total number of cases in the city is at least 300.
Sad news for Bicolanos. Representative Maria Dita Ditas Ramos of the 2nd District of Sorsogon has died from COVID-19. Deputy Majority Leader XJ Romualdez announced her death during a House plenary session. The lady lawmaker was the 8th House member to get infected with coronavirus. The 76-year-old public official was the 2nd House member to die from the disease, following Senior Citizens Representative Francisco Datol Jr., who was 71 years of age.
Meanwhile, the country's Department of Health says that 3,281 new cases were reported today, based on tests done by 81 out of 115 operational laboratories. In the National Capital Region, 1,420 fresh cases were added today, followed by Cavite with 263 additional cases and Negros Occidental with 204. Those figures raise the cumulative COVID-19 cases in the country to almost 242,000. The total active cases increased from yesterday, now at close to 53,000, of which 88.6% are in mild condition. We have lost 26 more patients. But through our fervent prayers, medical interventions, and sacrifices of our medical frontliners, 286 more people have won their battle against the invisible enemy. That brings the total recoveries nationwide to 185,178. Thanks be to God.
President Rodrigo Duterte will procure cheaper vaccine against coronavirus disease 2019. The country's chief executive reiterates his belief that a vaccine will be available this month of September as companies in the US and China are rushing to develop one. He says, however, the Philippines will procure whichever is cheaper. Aside from China, Russia has also offered the Philippines COVID-19 vaccine supply when it is available.
Alam mo kasi, sinabi ko nga, meron na. I think it's Moderna is a US company. I think they are ready by September. Hindi nga. Sabi ko nga, pabilisan na sila. Sinovac ng China is also ready. Kung sino, pare-pareho lang naman yan. Parehong germs yan eh. Kung sino lang nauna, magbigay sa atin na mura, doon tayo pupunta. Kasi they know that they do not have enough money. Kung mahal masyado, we will go for the less expensive ones.
At this point, the World Health Organization continues to study reinfection on COVID-19 cases through genome sequencing. Nina Armilio tells us why.
The World Health Organization continues to study reinfection in COVID-19 cases. What scientists know is that a person infected or exposed to SARS-CoV-2 develops an immune or antibody response, which could take a week or two or even longer after that infection. According to WHO technical lead on COVID-19, Dr. Maria Van Kerkhove, we are only 8 months into the pandemic, so they haven't followed individuals for many months how strong that antibody response is or how long it lasts.
And we are seeing that people, even with asymptomatic infection, still develop an immune response. What we need to better understand is how strong that is and for how long it lasts. There are a number of studies that are underway that are following individuals, the same individual over time. And there are some very promising results from these studies that are showing that the antibody response lasts, it stays strong for a certain number of months.
Dr. Van Kerkhove cited reinfection in Hong Kong, in a preprint in the USA, and a small number of other examples in a couple of countries.
In those individuals, what we are looking for is what type of an immune response did they have on their first infection, if that was even measured, and then at the time of the second infection, did they have measurable antibodies? And I think that's really important for us to really understand, to see if that immune response lasts, because in some individuals, an immune response may decline. But again, we do need to put this into context. Out of more than 26 million cases, having some case reports of reinfection tells us that this is possible, but it doesn't tell us what's happening at a population level.
For now, the World Health Organization, by working with laboratories, continues to look at full genome sequence to see if there's second infection. Nina Armilio, UNTV, News and Rescue. We serve the people. We give glory to God.
Also, the World Health Organization calls on countries to invest more in their public health systems. WHO Director General Dr. Tedros Adhanom Ghebreyesus notes that countries with a strong public health system have responded to the coronavirus pandemic in a better way.
So investment in public health and primary health care is essential.
Dr. Tedros underscores that public health is the foundation of social, economic, and political stability. That means investing in population-based services for preventing, detecting, and responding to the disease.
COVID-19 is teaching all of us many lessons. One of them is that health is not a luxury item for those who can afford it. It's a necessity and a human right. Part of every country's commitment to build back better must therefore be to invest in public health as an investment in a healthier and safer future.
Let's now take a closer look at the updated count of coronavirus cases around the world. The COVID-19 pandemic has now reached a total of more than 27.3 million confirmed cases in 188 countries, regions, and sovereignty. That's after more than 265,000 new cases have been reported since yesterday in various countries. The fast-spreading disease has claimed almost 893,000 lives, while more than 18.3 billion patients across the globe have recovered from the new coronavirus infection. Thanks be to God.
Speaker Alan Peter Cayetano has met with Philippine National Police Chief Camilo Cascolan and Director for Controlship Emmanuel Licup to discuss how lawmakers can support and complement the PNP's development plans. Those plans include establishing more women's desks to address the surge of domestic abuses, putting up state-of-the-art crime laboratories that will improve crime investigation and solving, improving the public perception towards the police organization, and procuring more equipment necessary to uphold law and order. This as the House of the Representatives works closely with the Philippine National Police in ensuring peace and order in the country.
The Office of Civil Defense will make sure to implement the minimum health standards during the simultaneous national earthquake drill on September 10, 2020. The NDRRMC, meanwhile, orders local governments and the private sector to update their disaster contingency plans. Vincent Arboleda will tell us why live. Yes, Vincent?
Yes, Harleen, health experts believe that COVID-19 will stay for several years. Because of the danger posed by COVID-19, the Office of the Civil Defense, together with the National Disaster Risk Reduction and Management Council, will now incorporate in the nation's disaster preparedness the minimum health standards to prevent the spread of COVID-19. On Thursday, September 10, 2020, the NDRRMC will conduct a simultaneous earthquake drill. This will be held online at 2 p.m. And unlike the previous earthquake drills, the ceremonial pressing of the button that marks the duck cover and hold procedure will be streamed via Facebook Live. And due to the danger posed by COVID-19, the minimum health standards will be implemented. If at home, make sure to wear your face mask and face shield before going outside. If inside your office, keep wearing the face mask and face shield and proceed outside of the building to an open area while maintaining physical distancing. If there are many individuals on the designated area, individuals will be grouped per family. According to DILG Undersecretary Jonathan Malaya, the government will every member of the family to be responsible to better prepare for any disaster or pandemic.
Kung masisiguro po natin na hindi magkakahawaan sa mga bahay at kung masisiguro po natin na pag lumabas tayo ng bahay ay protektado tayo laban sa COVID-19. Malaking bagay po yan sa prevention program ng ating pamahalaan.
The NDRRMC also started including COVID-19 measures on the National Disaster Preparedness Plan. Under the Memorandum Number 57 Series of 2020, local governments and the private sector are also told to update their contingency plans.
If you have your public service contingency plan or your business contingency plan for the private sector, and of course your contingency plan for earthquake or whatever hazard that you may have. Paki-update na po natin sila. Let us review and update it, focusing or let it be COVID sensitive.
Harleen, the agency is also calling on the public to participate on the activities on earthquake preparedness. Back to you, Harleen.
Vincent, aside from the earthquake drills, are there any mobile applications that can help the public to better understand or perhaps prepare for disasters such as an earthquake?
Yes, Harleen, there are several applications that can be downloaded via the App Store or Play Store, such as the Hazard Hunter, which can locate areas which are prone to flash floods, landslide prones, and those areas near volcanoes and others. There is also this Fault Finder app, which can measure your distance to the nearest active fault line in your area. Back to you, Harleen.
All right, thank you so much, Vincent Arboleda, for that report.
The proposed budget of the Defense Department for 2021 is increased by 17 billion pesos. Meanwhile, Veterans Memorial Medical Center is asking for additional budget for medicine. One of our senior correspondents, Ray Pelayo, explains why.
Bataan Representative Geraldine Roman asked the House Committee on Appropriations to support the additional budget for the medicines of Veterans Memorial Medical Center or VMMC. The hospital noted in today's hearing at the House of Representatives that out of 585 million pesos that VMMC requested from the Department of Budget and Management, only 116 million pesos has been approved. That is equivalent to a bit over 2 pesos each for 200,000 veterans.
Taasan po natin. Kahit hindi po katanggap-tanggap ng 2 pesos and 20 centavos ang ibibigay natin, tulong panggamot ng ating mga veterano. Sila na nagsakripisyo ng kanilang buhay, pinagsapalaran ng kanilang buhay upang ipagtanggol ang ating bansa. Hindi po, this is unacceptable.
VMMC is a referral center for COVID-19 patients which has accepted almost 500 cases to date. 120 of its health workers had contracted the disease but have already been able to return to work. VMMC's fund is part of the total budget proposed by the Department of National Defense amounting to 283 billion pesos for 2021. Secretary Delphine Lorenzana said this is almost 17 billion peso higher than the agency's budget for the current year. The defense chief notes that the additional budget is for the additional personnel and equipment. The DND also continues to patrol the Philippines' exclusive economic zone, especially the West Philippine Sea. Pag-asa Island is one of the 9 islands in the area defense personnel are manning. Development of the airport on the Pag-asa Island continues, which is expected to be finished within this year. Lorenzana updated the lawmakers on the soldiers' activity in the West Philippine Sea.
Yung pong mga barko natin sa mga aeroplano, panay rin ang patrolya dyan. Yung ating mga patrolya ay sina-challenge ng China. Tayo naman ay palagi natin sinasabing tayo ay lumilipad sa ating airspace o tayo ay naglalayag sa ating sa ating waters.
Ray Pelayo, UNTV News and Rescue. We serve the people, we give glory to God.
The Commission on Elections, or COMELEC, advises the public to register as early as possible for the coming elections. Asher Kadapan Jr. details why.
The Commission on Elections continues to appeal to the estimated 4 million Filipinos who are now eligible to vote to register within the current voter registration period. COMELEC assures the public that health and safety protocols are strictly implemented and alternative ways of the process are provided for a safe conduct of the registration of new voters as well as of those who need to file an application for transfer. For everyone's guidance, applicants may download the 2-page application form from COMELEC's social media accounts. They should print 3 copies of the form using long bond paper with a size of 8.5 inches by 13 inches and not the A4 or legal size paper. Fill out the forms but do not affix your signature yet, as this should be done in the office of the election officer in your respective cities or municipalities. Although this process is not mandatory, COMELEC strongly recommends this to avoid longer transactions in filling out the forms in the COMELEC office.
So ini-encourage po namin ang lahat para mapabilis ang transaction ninyo sa COMELEC. Please download the forms, no? Yung forms are available freely or free sa COMELEC offices. Pero again, medyo tatagal tayo doon kapag dun nyo lang gagawin, dun nyo lang i-fill up.
COMELEC also recommends setting up an appointment to schedule when to go to their office to avoid overcrowding. This can be done by calling the local COMELEC office through the phone numbers on their website or by sending a message through their Facebook page. If there is no access to internet and printing, applicants may simply go to the office of the election officer in their respective localities. Just bring any valid ID that shows your current address. Otherwise, COMELEC may ask for supporting documents. As much as possible, bring your own pen to be used for signing your application form in the COMELEC office. Wear a face mask and a face shield. Once inside the COMELEC office, the face coverings will be removed only while photo capturing for the biometrics. A health declaration form should be filled out upon entering the office, although it can be done online by sending a message through COMELEC's Facebook page. The offices of the election officers are open from Tuesday to Saturday from 8 a.m. to 3 p.m. The voter registration period is until September 2021. Meanwhile, voters who will be out of the country from April 9 to May 9, 2022 may register for overseas voting in the COMELEC office in Intramuros, Manila until August 2021. This includes Filipinos who will turn 18 years old on May 9, 2022 but will be overseas on the same date. Overseas voters are also encouraged to schedule an appointment before going to COMELEC through different means, as they will be given an appropriate form and to make sure their applications are valid. COMELEC appeals to the public to register as early as possible for COMELEC personnel to manage applicants in the local COMELEC offices. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
President Rodrigo Duterte has advised Health Secretary Francisco Duque III not to resign, while Senator Panfilo Lacson says the health chief has been cleared of any wrongdoing in the PhilHealth mess. Our Malacanang correspondent Rosalie Cos tells us why.
End of story, and the accused have been cleared of any wrongdoing. This is the reaction of Senator Panfilo Lacson after President Rodrigo Duterte defended Health Secretary Francisco Duque III anew. According to the senator, with the president's appointed chief investigator to his right and one of those being accused in the PhilHealth mess to his left, he cleared the accused of any wrongdoing, including DOH Secretary Duque. Last night in his public address, the president said his confidence and trust in the health chief remains, adding that he believes the DOH secretary is not involved in the alleged corruption in the state insurer. Thus, the president has advised Secretary Duque not to resign.
Secretary Duque, this is not the time for you to resign. Hindi pa panahon mag-resign. I've heard stories about you going to resign. I have full trust in you.
I have to express my frustration, sir. I hope you don't mind. Yung mga pumirma, hindi man sila nirecommend. Yung mga pumirma, hindi nirecommend for filing of the cases. Yung hindi pumirma, yun lang ang idinawit. Parang, bakit naman ganon? But height of injustice, unfairness, and masakit po yan, sir.
Meanwhile, for Senate President Vicente Tito Soto III, the chief executive should talk to the senators and not just listen to the excuses of the accused. It is also better if President Duterte had read the Senate report. Next Monday, Task Force PhilHealth will submit to President Duterte its reports and recommendations, including the filing of charges against officials and personnel involved in irregularities, anomalies, and corruption. Rosalie Cos, UNTV News and Rescue. We serve the people, we give glory to God.
Manila City Mayor Francisco Isko Moreno Dumagoso orders the temporary close of cemeteries in the nation's capital from October 31 to November 3. This through Executive Order 30H, which he signed today. The local government wants to avoid the possible overcrowding in those places.
Kung mabisang dumami ang coronavirus ay dahil yung sa ating pakikihalubilo, siksikan, sama-sama sa isang lugar para maiwasan natin ang patuloy na paglago ng coronavirus through this situation, ay pansamantala ko po itong isasara.
Based on the executive order, only interment and cremation services for non-COVID-19 cases will be allowed where minimum health standards must be observed. But the mayor clarifies that if there are any changes pertaining to the public health protocols prescribed by the national government, like the improvement of health condition, he will make the necessary revocation of the executive order.
Kung sakali naman, total ito po'y 2 buwan pa naman, ano? No? Kung sakali naman, dumating ang vaccine, no? O yung vaccine para sa coronavirus, para hindi na tayo magkasakit at gumaling na rin na may mga sakit, no? By October 30, no? Akin rin po itong kakanselin.
Now, here's a glimpse of what's the weather like in parts of the country. The ridge of a high-pressure area is affecting northern and central Luzon. State Weather Bureau Pagasa says Metro Manila and the rest of the country will experience partly cloudy to cloudy skies with isolated rain showers due to the ridge of the HPA or localized thunderstorms. Still, possible flash floods or landslides may occur during severe thunderstorms. No tropical cyclone advisory is issued. President Rodrigo Duterte granted an absolute pardon to U.S. Marine Joseph Scott Pemberton yesterday. Dante Amento tells us why.
Many were surprised when President Rodrigo Duterte granted absolute pardon to U.S. Marine Lance Corporal Joseph Scott Pemberton yesterday after serving more than 4 years in prison. Pemberton was convicted of homicide over the killing of trans woman Jennifer Laude in Olongapo City in 2014. But what is absolute pardon? Based on the definition stated in the revised Rules and Regulation of the Board of Pardons and Parole, absolute pardon refers to the total extinction of the criminal liability to whom it is granted without any condition. Attorney George Erwin Garcia, College of Law Dean of the Pamantasan ng Lungsod ng Maynila, says that granting absolute pardon is an exclusive power of the President that no one can challenge when and to whom he wants to grant it.
In fact, hindi ka pwede magawa ng kahit anong batas para ilimit ang pag-exercise ng kapangyarihan ng Pangulo ng pardon. Hindi pwedeng gumawa ng batas sapagkat that is an exclusive authority po and domain of the President of the Philippines. Kahit ang Supreme Court, hindi pwedeng i-check. Ang Congress cannot even share with the exercise of that power.
And by granting such to an individual, this will also reinstate the person's civil and political rights, such as the right to suffrage and to run in political race, just like what happened to former President Joseph Estrada. Estrada was given an absolute or presidential pardon by former President Gloria Macapagal Arroyo, and he later ran and won as mayor of Manila.
He is completely a new man. Balik muli siya sa lahat ng nai-enjoy niyang karapatan kahit siya ay nagkaroon ng record ng conviction.
Even those convicted of heinous crimes can receive absolute pardon from the chief executive, but cases of impeachment involving impeachable officials like the President, Vice President, and Ombudsman are not included as stated in Article 7, Section 19 of the 1987 Constitution and election offenses. Attorney Garcia adds, the President had already granted absolute pardon before.
Ngayon lang kasi nadidiskubre ng mga ilan nating kababayan na meron palang pardon ng Pangulo. Ang panawagan na lang natin, sana mas madami pa ang makinabang sa kapangyarihan ng pagpapatawad ng isang Pangulo.
Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
Vice President Leni Robredo has questioned the granting of absolute pardon of President Rodrigo Duterte to U.S. Marine Lance Corporal Joseph Scott Pemberton. In a statement, VP Robredo asks if the decision to pardon the U.S. Marine is fair and just, noting that thousands of Filipino prisoners remain in jail because of their inability to pay lawyers and cannot avail of the same privilege that Pemberton enjoys. The case of Pemberton, according to the Vice President, is just one of the many examples that the government favors those who are in power. She adds, it shows that those who are poor face punishment while the rich can be free. VP Robredo hopes the President exercises his vast powers in a manner that is fair and that benefits the common Filipino. Meanwhile, for Senator Risa Hontiveros, the decision is an unbelievable affront not only to the LGBTQ+ community but to the Filipino people.
Ang presidential pardon na nagpapalaya sa dayuhan na pumatay kay Jennifer ay dagdag hinanakit, hindi lang sa pamilya niya, kundi pati na rin sa LGBTQI+ community at sa mga Pilipinong naghahanap ng hustisya.
However, some senators expressed support on the president's decision. For Senate President Vicente Soto III, the case of Pemberton is now closed. He also noted that the decision of the president is immune from any challenge from any person, and such complainant must first seek to amend the Constitution if he so desires. Aside from thanking the president for laying the issue to rest, Senator Amy Marcos also called on President Duterte to certify as urgent the Sexual Orientation, Gender Identity and Expression or SOGI bill to ensure that violence and discrimination against members of LGBT+ community won't happen again. And for Senator Christopher Bongo, he respects and supports the decision of President Duterte.
Meanwhile, the armed forces of the Philippines seizes a greater urgency to toughen the country's drive against terrorism. Leia Lagan tells us why.
The AFP confirms that 47 incidents of bombing in which improvised explosive devices were used took place in Sulu, Basilan, and Zamboanga from the year 2009 to August 2020. The armed forces of the Philippines have recorded 83 deaths and 505 injuries. 20 of the fatalities were military personnel, while 63 others were civilian. 70 government troopers were left wounded, and 435 civilians were injured from those bombings. Because of this, AFP Chief of Staff Lieutenant General Gilbert Gapay says that he sees the greater urgency to toughen the country's drive against terrorism due to the rising terror threats by the Abu Sayyaf group and other local terrorists. The latest bombing incident was the twin bombings that happened in Barangay Walled City, Hulo, Sulu on August 24, which killed 15 soldiers and civilians and wounded 74 others. General Gapay confirmed the group of Mundi Sawadjaan was behind the bombings. Sawadjaan is the nephew of Hatib Hajan Sawadjaan. The twin blasts were perpetrated by two female suicide bombers, according to the authorities. One of them was the wife of Filipino suicide bomber Norman Lasuca, and the other was the wife of Abu Talha or Talha Jumsa, the bomb expert trained by the ISIS, killed in a military operation in 2019. General Gapay stands firm that the AFP does not tolerate the Abu Sayyaf group's terroristic acts. He adds that under the provision of the anti-terrorism law, they will make sure that all their efforts and capabilities will be utilized and prevent terrorists from inflicting further harm to the people. Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
And for the news abroad, here's Kath Dumaraos reporting live from Bangkok, Thailand.
After 100 days of no local infection, a 37-year-old male inmate tested positive of the coronavirus disease last Wednesday, September 2nd, in Thailand. Health officials have identified 990 people to be at risk. High-risk contacts have been advised to go on a 14-day quarantine, including the man's family and his colleagues at work. 3 pubs where he worked as a DJ had been closed until yesterday, 7th of September, to be sanitized and disinfected. Authorities are trying to determine how he was exposed since the man had no travel history outside the country. Department of Disease Control Director General Suwanachai Watanaying Charoenchai has said that the new local infection was not the second wave and that he is confident the situation could be kept under control. Half of almost 1,000 people that had been in contact with the patient have tested negative for the virus. The number of new daily cases in Hong Kong has dropped into the single digits. The city announced today it would relax more of its coronavirus restrictions. The Hong Kong government will now increase the size of public gatherings from 2 to 4 people. Swimming pools will remain closed, but more sports venues will reopen starting this Friday. According to Health Secretary Sophia Chan, the third wave is entering 2 months already, and they have yet to see an end to it. Let's now take a closer look at the updated count of coronavirus cases in countries worst hit by the pandemic. The USA, still on top of this tally, now has more than 6.3 million cumulative cases of COVID-19 with over 189,000 death cases. India, now the country with the second largest caseload, records its highest daily deaths in more than a month, 1,133 people in 24 hours. While in Brazil, the country with the second highest number of COVID-related deaths after the US, the daily death toll on Monday dropped to its lowest in 4 months. Russia, although the country with the fourth largest case count, has kept its death toll below 20,000. Meanwhile, the Americas contribute almost half of the total global case count of coronavirus cases, with close to 14.2 million. Companies fined for misleading advertising and illegal importation of health products claiming to prevent COVID-19. Joining us tonight is one of our correspondents in Australia, Marvy Delfin, to tell us why live. Marvy?
Kath, Australia's health regulator known as the Therapeutic Goods Administration or TGA has issued just a little under $1 million Australian dollars in fines for misleading advertising and illegal importation of health products to profit from the coronavirus crisis. According to data from TGA, 81 infringement notices totaling to 847,000 Australian dollars were issued to various companies for unlawful activity in the selling of masks, medical devices, disinfectants, hand sanitizers, peptide products, and thermometers since the start of the COVID-19 pandemic. Some of the products involved include a bionic air plasma machine claiming COVID-19 prevention for elderly patients, Yarra Valley's cleaning disinfectant claiming 99.99% effectiveness against viruses including COVID-19, and Oxymed's hyperbaric oxygen therapy chambers claiming treatment for COVID-19. The company's fines were ordered to remove advertisements of such products, but a few failed to do so, prompting the TGA to commence federal court action. In response to this, the TGA has then introduced new rules to prevent advertisements making claims about a product having an effect on the virus without the expressed permission by the Health Administration. Deputy Secretary of the Department of Health John Skerritt said, as the COVID-19 pandemic continues, the TGA is determined to stamp out advertising which makes unlawful claims about the cure or prevention of COVID-19. He added, advertising targeting vulnerable groups, including seniors, is of particular concern to the TGA during these challenging times. Kath?
Marvy, in the early stages of the COVID-19 pandemic, we have also seen a large number of test kit suppliers to enter the market. What was the stance of Australia's Health Regulation Authority on this?
Kath, you're right. There has been an increased production and supply of rapid 15-minute point-of-care screening kits, which detect antibodies compared to the government-preferred genetic testing. TGA's assessment of these rapid test kits was specially accelerated due to the huge demand for testing equipment. In fact, earlier this year, there was a controversy with a company named ProMedical that the Australian Health Department had entered a contract with for the purchase of 500,000 rapid test kits that was to be sourced from China. It was then revealed that ProMedical was run by a convicted rapist with little diagnostic experience and was linked to a failed testing kit supply deal with Puerto Rico. Due to this, the TGA launched a post-market review with the help of the Doherty Institute, verifying the ability of rapid test kits to detect antibodies to COVID-19 and analyzing evidence that support performance claims. One testing kit supplier was removed from the market and another 7 have taken themselves off the therapeutic goods register voluntarily. Kath?
Thank you, Marvi, for that report. And those are the reasons behind the news here in Thailand and in other parts of the globe. Back to you, William.
Thank you. Kath Dumaraos reporting live from Bangkok, Thailand.
The Tokyo Olympic Games will go ahead next year with or without COVID, the Vice President of the International Olympic Committee says. The Games were originally scheduled to start in July 2020, but were postponed due to the COVID-19 fears. Japan's Olympic Minister Seiko Hashimoto has said the Tokyo Olympics should be held next year at any cost, that is, regardless of the challenges and risks posed by the coronavirus. John Coates, Vice President of the International Olympic Committee, has said the Games would go ahead next July with or without COVID. Organizers are now looking at ways to hold the Games safely, including antivirus measures at the Athletes' Village. Eating red meat cooked at high temperatures increases risk of heart disease, researchers say. Jovic Burmas explains why.
While the world's best chefs have taught us how to cook red meat to produce that extra flavor, from grilling to pan-frying steaks, a new research from the University of South Australia suggests this might not be the best choice for people looking to cut their risk of disease. The study, conducted in partnership with the Gyeongsang National University, found that consuming red meat seared at high temperatures, such as grilling, roasting, or frying, creates compounds called advanced glycation end products, or AGEs. These AGEs, when consumed, can accumulate in the body and negatively affect normal cell functions that may increase the risk of heart disease, stroke, and complications of diabetes. Though largely preventable, cardiovascular disease remains the #1 cause of death globally. Dr. Permal Deo, a UNISA researcher, says consumption of high AGE foods can increase our total daily AGE intake by 25%, with higher levels contributing to vascular and heart tissue stiffening, inflammation, and oxidative stress, all signs of degenerative disease. The study, published in Nutrients, also tested the impacts of 2 diets, one high in red meat and the other in various food sources. It found AGE levels in the blood significantly increased with diet high in red meat, which may contribute to disease progression. Professor Peter Clifton, co-researcher from UNISA, said the message is pretty clear. If we want to reduce heart disease risk, we need to cut back on how much red meat we eat or be more considered about how we cook it. Clifton suggests slow-cooked meals could be a better option for long-term health to reduce the risk of excess AGEs. Jovic Burmas, UNTV News and Rescue. We serve the people. We give glory to God.
And those are the reasons behind the news, September 8, 2020. I am Harleen Delgado.
Because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.